This is where I get frustrated.
Don't even open that can of worms.
Like horrifying.
Horrifying. Not allowed to cry or have emotions in your house.
Like, do you really need to know what Zimoglyphosate is? Or
Oh, Jessica.
everyone has a favorite. Everyone does.
So we are going to be talking today about PANS and PANDAS again. So y'all have probably heard me talk about my son. One of my sons has PANS, and so it's kind of become like my mission to increase awareness about PANS and PANDAS. So we have a repeat guest today, Dr. Benton Marino, who talked with us about PANS and PANDAS recently, and he's back to kind of dig in more about it. So, Dr. Marino, if you wouldn't mind just kind of explaining again, what is PANS and PANDAS?
Well, first, thanks for having me on the show again. I enjoyed it last time, and
Great.
hopefully I do a decent job this time. It's my second time on a podcast. So dive right in. The diagnostic criteria for PANS and PANDAS is an abrupt onset of or dramatic onset of recurrent OCD-like symptoms. Or an acute onset of anorexia or severe restrictive eating disorder, plus two of the next kind of 7 diagnostic criteria: separation anxiety, emotional lability, behavioral or developmental regression, sensory or motor abnormalities, which might be a handwriting deterioration, or it might be tics is a common one. You might see deterioration of school performance. A very common one is urinary symptoms, which may be urinary frequency. Like I have to go to the bathroom, I have to go to the bathroom over and over again without, a urinary issue like a UTI, or bedwetting, which wasn't present prior to the onset of PANS or PANDAS, and then sleep disturbances. So it's the OCD or restrictive eating plus 2 of those kind of 7 symptoms that I outlined. And then the difference, so PANDAS is pediatric autoimmune neuropsychiatric disorder associated with strep infections. So it occurs usually shortly after a strep infection, or maybe a few weeks after a strep infection. And then PANS is the same thing, but it's pediatric acute-onset neuropsychiatric syndrome, which occurs after usually some other inciting factor, which is not the strep. Viral illnesses like the flu may be a common one, but it could be anything, not just a virus. It could be other bacterial illnesses other than strep. Like mycoplasma is a very common one.
What's that?
Mycoplasma is a bacteria. You asked this on the last podcast. So mycoplasma is a bacterial infection that is commonly blamed for walking pneumonia.
So that's what Hartson had. That's what my son had. Yeah.
So that's a common cause of PANS, but you could have other things like environmental issues such as mold or other toxins might be part of it, but or it could be multiple things together. And then if you read or listen to other providers around the country, a lot of the people in the Northeast will blame like tick-borne illnesses, which I don't think we see. Too frequently down here. I think mold is an underlying issue in some of these kids.
I have a question. Can strep be something else or something other than strep throat?
Like, can you get strep infections elsewhere?
Yeah, like is it? Yeah, I guess.
You can, yeah.
Like what is strep? Like what is strep?
But I would say is when it comes to PANDAS, it's probably most often like strep throat causing it, right?
So yes and no. So you do see strep. So strep is a bacteria. So group A strep is different than there's some other bacteria that have the same name in it, like strep pneumoniae, which is a totally different type of bacteria that might cause pneumonia or ear infections. But strep throat is group A strep, and then you also hear about group B strep, which can cause issues, before birth and or excuse me, a screen before birth because it can cause
I remember that.
infection shortly after, for the infant. So group A strep, which is what we're talking about here, is the common cause of strep throat. Everybody knows about that. But you can also have group A strep cause skin infections, so perianal strep. So you can get strep on your bottom.
Yep.
What?
And
your
that's
bum hole.
actually
Stop it.
Yes.
How do you get that?
well, so probably oral transfer.
Yeah.
You know, so
Well,
kids
it happens in kids.
put their
I-
hands
yeah,
in their mouth and then they
Yeah.
touch their
their
bottom.
butthole?
Yeah.
So
Yep, that's how it happens.
Okay. All right.
and then you can get it on your skin as well. So you can get you know, an open wound and it can get infected and
Like staph?
well,
No.
so
Like isn't that what causes impetigo?
so similar. Well, so impetigo can be caused by strep or staph.
Okay, okay.
But it's similar. So you can get you've got an open wound and the actual bacteria there is strep, but staph can cause you know, impetigo and so can strep. So,
All right.
yeah.
We're learning all kinds of things.
I know.
Jessica?
Wait. So Monroe, this was 2 summers ago, and we were up north in Cape May. And she
I've
got
been there.
Oh, you have?
Yeah.
It's so freaking cute. Anyways, that's another story. I'm obsessed with it. She and I are just prone to bites. Like bugs love us. We get like wild reactions to mosquitoes, whatever. Like she got bitten by a recluse at the fucking pool
Oh, wow.
like 3 days ago.
Yeah.
She's on antibiotics. Anyways, but she got bitten by a tick. We had to take her to like some random urgent care. It was like the big ring and the whatever. So is she now like more susceptible to get one of these?
Not necessarily, no.
Okay. Which one would this fall under? Pandas or pans?
Pans.
Pans.
If she were to
So
develop
if
it, right?
she had bacteria on the skin that was strep and it was an actual, you know, you got strep from, you know, in that wound, I mean, that could be pandas. But if it's, you know, if there's a different bacteria that was the trigger, then that would be pans. Or if it's a toxin from a insect, I guess that would be pans too. I don't know.
But
But
like,
if it's just like the tick-borne illness,
Yeah,
that's
the
Lyme
tick-borne-
disease.
yeah.
Oh,
So
the
that's,
tick-borne illness. I
yeah,
thought-
yeah. So that would be
Yeah.
pans.
it would be
Yeah.
pans.
Yeah.
Correct.
Yep.
Yep.
Okay, keep going. All right, so we defined. Okay, so this was a question that I had just because of you. Like, you had to go through the whole rigmarole to figure out like what the issue is.
Yeah.
It's like you had to rule out. You had to do this eval, this med, this supplement, this, and then finally you were able to figure out that it was PANS.
Right.
Is there a way, or are medical providers or the medical system working on a way to get a diagnosis faster?
I don't think so. I think it's more of
Yeah.
it's more of educating
Yep.
providers to what the clinical criteria might be. So signs and symptoms to look for.
Okay.
You know, so if somebody comes to your office and you know them well and they were neurotypical and everything's fine, and then all of a sudden you see this regression and you see this increase in some of the symptoms that we just described. You know, the urinary frequency, or they're wetting the bed and then their behavior is off. You know, I had one yesterday even. So I mean, the symptoms were, you know, bedwetting, you know, and behavioral regression, and the sibling had strep in October, and all his symptoms started in October, but he never showed symptoms of strep. So he had all these behavioral issues and all these urinary symptoms, and then, you know, some of the things that he was doing looked like a motor tic that he was you know, presenting with off and on.
How old was that kid?
He is 5.5, 6,
okay.
somewhere in that age group. And then so he was treated for another infection later on with an antibiotic, and it seemed to
Alleviate.
improve. And the parents are like, "Wow!" And then I think the doctor kind of put it together, you know, that this is probably what it is. So the interesting thing was he was being kicked out of his school, so asked to leave his school at 5 or 6 years old, because
No, but I know all about that.
they couldn't handle the child. And then the last week he was going to be there for one more week, and that was right after he'd been on those antibiotics, and they were like, "Man, he's doing really well."
Wow.
Yeah.
Still left the school, and he's at a different school.
Yeah, good.
But you know, so sometimes that's how you get the diagnosis, and I think we touched on that last time too. Is you know, it's clinical criteria, and then it's and sometimes it's how you respond to treatment.
Yeah. It's like the litmus test.
So, yeah.
Yeah. Yep.
What do you mean how you respond to treatment? Sorry.
Like if they go on an antibiotic and then all of a sudden like these symptoms go away, it's like, well, you
Obviously.
know, ADHD doesn't go away on an
Right.
antibiotic. You know, like conduct disorder doesn't go away on an antibiotic, right? So like if they get it on an antibiotic and everything goes away, then you know that's like the litmus test. Like,
But what
okay,
if it
this
doesn't?
is-
But it's still PANS or PANDAS.
That
Well,
can happen too.
Yeah, then so I think you need to keep digging to try
Yeah.
to figure out what is the root cause, or what, are you missing something?
How do you figure that out?
But I would say, correct me if I'm wrong. I think most parents that I talk to that have kids with PANS or PANDAS, like they usually do see, I'm not going to say all, but most, they usually do see like a pretty dramatic improvement after an antibiotic, antiviral, anti-inflammatory. It's just that it doesn't always persist, right?
Yeah, I mean, I would agree with that. I think, sometimes they'll see that it will happen in the past. They'll get this window. I'm thinking of another child where, he was put on antibiotics and then the kid's perfect for a few weeks and then has kind of a relapse.
Yep.
And then you put him back on antibiotics or he gets a virus.
Mm-hmm.
And the symptoms kind of come back and no matter, what you do or you're trying it, you can't get him back to where he was.
Yeah.
Mm-hmm.
So you do see that where the antibiotics don't work in certain situations. And usually that's the PANS cases that are not as clear cut where it's not just strep.
Yep.
Mm-hmm.
It's a virus like the flu and it sometimes takes a lot more time to work out.
Yeah. Yep.
So how was this done? I mean, this is probably a really obvious question, I guess, but like, how was this dealt with before? Like your friend, okay? Like it would just be like, try all the meds.
Mm-hmm.
That's just what it is. And then like they get older and grow out of it. Or do they get reliant on the meds because then the meds like I don't know, like.
So I think, and again, Dr. Marino, correct me if I'm wrong, but I think, so part of this is that like this condition is so much more frequent now than it used to be, right? So like when we say like, how do people used to deal with this? Well, it wasn't this common like 30 years ago, right? Like now it's like, it's becoming more and more common, more and more prevalent, right?
Correct.
So that's like part of the answer. I do think though, like, 20 years ago, 30 years ago, like my kid would have just like been on every medication and then expelled from school, end up in a boarding school or military school, or end up in like, I mean, that's just like the honest truth. I'm just being super honest because his symptoms were really severe. He would have ended up like in psychiatric hospitals over and over again. But we also didn't really see this. I don't think this was as much of an issue 30, 40 years ago because we weren't seeing this like high prevalence of autoimmune diseases like we are now,
Correct. It's it's an autoimmune process, or some people call it molecular mimicry.
Mm-hmm.
So for the strep example, the protein that makes up strep looks a lot like our body's tissue.
Mm-hmm.
So your antibodies attack strep and they recognize it, and then they go around the body and they look for other things that look like strep, and they attack the heart valve, which is the rheumatic fever, and then they attack areas in the basal ganglia, which is the PANDAS. So we're seeing more, like you're saying, I think more autoimmune issues. I think everybody has their suspicions as to why.
Yeah. I'm going to ask, why do you think?
I just think, our environment just is not as healthy, and we just all live a unhealthy existence. So there's a lot of environmental exposures, from, people talk about, plastics and the water and the food source and lack of minerals. And, we're sitting inside and not spending time outdoors. I think there's a whole lot of factors that go into
why do you think
we're less
I
healthy.
agree. No, 100%.
Nothing to add?
I think it's there's not one reason.
Yeah.
And it's not, and PANS and PANDAS is not the only autoimmune disease that's increasing in prevalence. Like it's all autoimmune diseases, I can't tell you how many people I know in my immediate circle that have Hashimoto's like I do. And that's not normal. Like,
but is
that's
it because
weird.
people are going to get checked out?
No, because when they do research, they can tell that this is not just attributed to increased diagnosis. Like there actually is an increase in the occurrence of these autoimmune diseases.
But is that because people are going to the doctor more?
No, that's what I just said. The research shows that like just an increase in awareness and diagnosis does not account for the like magnitude of this increasing prevalence.
So what is that research saying that it does account for?
Well, that's the problem, is that right? That's why, because we don't, but like how this is it's very hard to prove these things, right? It's super hard to prove like, oh, it's because of this or it's because of that, because it's 5 million things put together that are just causing these processes to be more common in our bodies.
Yeah, I'm just not. I'm going to well-verse myself because yeah, go ahead. Let's keep going. Because I'm not finished with this conversation, but I'm not going to have it now.
That'll be the third podcast when I get my hat.
Yeah, right. He's not getting that.
Okay, so let's
just kidding.
Let's talk about like why are certain children more susceptible to this than others?
Yeah, I mean, like you brought up, so it seems to be more common in families that have autoimmune issues. So,
Right.
Mom and dad have autoimmune issues. So dad has celiac, mom has, a thyroid, autoimmune disease, then, the child is more likely to develop, PANS or PANDAS.
Mm-hmm.
So you definitely see that in the family.
Yeah.
Pause. Sorry.
Yeah.
So the environment, the earth, the whatever, like we were all living like simpler, whatever, lives 30, 40, 50 years ago.
Mm-hmm.
So then if autoimmune diseases are more commonly, passed down
Right.
because of generational stuff or whatever, then how does that, then how are environmental causes increasing?
Because you have a genetic predisposition, right? And then you have an environmental trigger. Okay, this is like what we see for pretty much every medical condition, right? Is that you can have a genetic predisposition and never develop that disease. Okay? Because you were not exposed to whatever in your environment that triggered it. You can have a genetic predisposition and then you are exposed to something in your environment that triggers that cascade, in your body.
I've heard it, described kind of similar way. So the genetics loads the gun and the environment pulls the trigger.
Yeah.
So not everybody gets that environmental push to where the trigger or the pull with the trigger. But,
Right.
Even though they have the genetics. And
why?
So.
I'm just curious. I'm not trying to be argumentative.
No.
I'm purely curious. Why is that?
I mean, that's just like how human bodies are, I mean, and that's for psychiatric too. I mean, like we said this in the last episode we recorded, is that you can have a genetic predisposition towards schizophrenia, but that doesn't mean you're going to develop it. But if you're exposed to, let's say, marijuana at a certain age and you have that genetic predisposition, you're way more likely to actually develop schizophrenia. Okay. So you got to have the two things combined in order for the disease to happen.
Okay.
You would have been a great student, I'm sure.
Why? What do you mean?
Asking the why.
Yeah.
Why. It was always the best students. Always they knew everything.
Because
your teachers must have loved you.
I wasn't like this in school. I was very shy, painfully shy.
Well, you should go back to school and be your new you,
No, I'm not going.
Your new argument.
I can't even afford a social media person. I can't afford to go to school.
Okay, so can we talk about, we have talked about strep causing pandas. We've talked about, mycoplasma causing PANS or Lyme disease. Can we talk about some of these other potential causes like mold or what are some other toxins you have seen that have been the culprit?
Yeah, so when a lot of these kids come in, I do focus on some of the things that are easier to treat, so the mycoplasma and the strep, and usually they're there. So you have, either a past history of a strep infection, or you have a titer for mycoplasma that's elevated, or you have a history of walking pneumonia and you have a clinical suspicion that they had mycoplasma. And I try to treat those things. And the ones that seem to not do as well, so for example, you don't get the quick turnaround in a week or two, they're not back to baseline, or they do go back to baseline and they're quickly back to where they were. And you don't have this kind of waxing and waning, big breaks in between where they're doing well. The ones have you can't get them to where you would like them to be or get them back to where they were from a behavioral perspective. I think those are the ones you have to think about. Okay, is there something else underlying that you're missing? Because a lot of times, if you have a viral illness, if you're distant from that viral illness, things will get better. The bacterial illnesses, if you're treating them, they should get better.
Yeah.
But it's the things that are just smoldering, or underlying issues. And like I said, people in the Northeast and in other areas will talk about tick-borne illnesses. But I think here we live in a humid, hot environment. We are inside with our air conditions running. Our air conditioning units are sitting in the attics with 160-degree
Disgusting.
temperatures.
Yeah.
And
So
it's
gross.
40, 50 degrees inside the air conditioning unit. So the way we build here is a good setup for mold.
Yeah.
A lot of the buildings in the area are older, and you're just in a humid climate. So
Yeah.
Yeah.
so you're going to see exposure to mold for some of these kids. So the ones that don't do well or you have a hard time treating, I think a lot of those might be mold exposures.
Yeah.
And so that's something to address. It's a really difficult discussion to have with a parent because trying to tell them that you might have mold. And
I mean, we all have, you know what I mean? I feel like also shouldn't be a surprise. Like I'm terrible, but like I look up at our air vents,
Yeah.
and I'm like, yuck. You know what I mean?
Yeah.
And like I go like get a Clorox wipe. What else
Yeah.
are you gonna do? And like, but it comes back, So like I feel like everyone's house has some like level of mold.
Yeah, so I mean, it's ubiquitous outdoors in the environment, but if you have it inside of your house, it's probably too high of some of the mycotoxins that it releases. Breathing those in all the time aren't
Yeah.
Wait, so that,
great for you. So
is that
you
not
don't
everyone's
wanna,
house doesn't do that?
I think a lot of
it's super
people's.
common.
I think it's common, but yeah, not everybody's house. I think is
Okay,
covered.
yeah,
in
I
mold.
paid so much for mine.
Yeah.
Okay, let's go.
So, but that's a topic that I bring up if we're not improving. So
Yeah.
it's not the first thing that I go to. If the kids are doing well, we don't discuss that.
Yeah.
Right.
And I usually try to give them some resources to educate themselves on other causes because
Right.
you don't have the time to go
Yeah.
over everything. But some other environmental things that I do see that might be of a concern would be some of the dyes in the food.
Oh,
now, this
God.
isn't common, but some of the kids, and I have a few in particular that with PANS and PANDAS, they're exposed to red dye, for example. They have some setbacks or they have a flare. They're
Yeah.
short-lived, but then they have the dye again 3 days later. So I do try to tell them to stay away from dyes.
Where
more
is
so
that? I
than
forgot what that's in.
everything. Anything that has like a red or orange color for the most
in my
part. That's
tea.
at the grocery store.
So is
Not
this?
necessarily.
No.
No.
Probably like it's
Yeah.
processed foods.
All right.
Yeah.
Okay.
So I do go over, kind of a healthy eating and staying away from a lot of the processed junk and especially the dyes,
Yeah.
because that does set some kids back. Most of the time, it doesn't. I don't want to say that because I don't want to give everybody like all of
Yeah.
my patients, that if you have PANS or PANDAS, you probably should be avoiding it anyway. But if it's the one-off and you don't tell them, and that's one of the things that's triggering them, so that's something out there in the environment that's easy to remove,
Right.
and they can change that. That'll really move the needle, for some of these kids. So
Well, and it's like, if you have a kid, like you said, if you have a kid who's responding, they respond to like the first round of antibiotics and then like they're symptom free forever, right? Then you're probably not going to have as many of these conversations, right? It's like when the kid keeps relapsing. And we do this too in psychiatry. Like that's when like you have to do more to get that kid well, right?
Yeah.
Like if I have someone who has, they keep relapsing with depression, then my conversation is going to be very different with them about what they need to do. Like, it's like, okay, now we got to like do 50 different things to get you well. It's not just going to be this one medicine and then you're done, So
like I think about that. Like, let's say let's use depression. Someone comes in and like they are presenting depressed, and they are feeling depressed. They're having symptoms and all that stuff. And you try the medications and they work, but then they don't. They work, but then they don't. Like, what am I trying to say? Like, could the symptoms be from not diagnosable depression? Like life or whatever. Like life is stressful or like this hard thing happened and you're just not like dealing with any of your shit.
Right.
And so you just like, it's a nice Band-Aid. It makes you feel better, but then you either have to go up or do a new med or whatever.
Right.
Like now I just lost my train of thought. What was the
Could it be from something else that's not?
Yeah.
Well, yeah. And that's when you end up having those conversations. And I think it's the same thing with this. It's like if
what if it's a parenting thing? I mean, or I don't know.
It could be. Yeah. Like, no, I think absolutely. Like when you have a kid that has this and they are relapsing multiple times, you got to do a million different things. You got to like change the parenting. You got to work with the school. You got to change their diet. You got to, increase supplements. You got to increase their time outside, whatever. Like you have to look for mold. You got to do a lot of different things to help them.
But you don't have to do it all at once.
No. But it's not going to be, there isn't going to be like an easy answer for those kids. I think that's the point, right? Yeah. It's not going to be like an easy one and done, one treatment and they're better. You know?
But all the kids that come in, I usually try to give them some sort of either guide them in the right direction to finding more information about it, or else I'll send them usually like a little sheet of like about eating healthy, looking out for things like mold, avoiding the dyes, making sure they're not playing video games all day long, or watching TV all night, or like there's simple things like sleep habits and a lot of the other things that you're going to talk about anyway, like with a wellness pediatric exam. But because their child is difficult, a lot of times they just kind of let them, sit on the video games and stay up late. And, so it's because they're more difficult child behaviorally. So we do have to go. We do talk about that a little bit, and I usually let them know or give them some education on that or point them in the right direction that there are things that they need to be doing at home from a behavioral perspective. And that's all, that's part of it too. So the treatment is going to be usually antimicrobials, which are mostly going to be antibiotics. And then, part of it's going to be, the psychotherapy or psychiatry or counseling, that's a big piece, which I think that helps with the parent the child better. Yeah. And then, immunotherapy is the other kind of piece to it. So it's like three prongs.
And I may be
it's not just antibiotics.
Yeah. Yeah. Antibiotics, do they weaken your immune system in any way?
These questions are.
I'm kicking that back to you, Dr. Marino.
I'm not doing it on purpose, I swear.
No, I don't think they don't suppress your immune system, but if you take antibiotics prolonged, you can have other problems. So there's side effects from taking prolonged antibiotics. You could destroy a lot of the microbiome in the gut, and I think people are wary about taking antibiotics long term. And that can affect your immune system, I guess, down the road. But you want to work on that after you've been on the antibiotics or while you're on the antibiotics, and keeping that in mind. And then you can certainly build resistance to certain, a lot of other bacteria might become resistant to the antibiotics that you're using. So that's a piece of it. So you can't just put a child on an antibiotic forever. Although there have been kids that are on antibiotics for a really long time, and it's the only thing that keeps them in school, regulated, really out of a flare. And that sometimes happens. And that's the way that I think originally PANDAS was treated, but I think most providers are moving away from that and keeping in the mind that, you need to worry about some of the side effects that you're talking about.
Yeah. And like if
does that answer your question?
Yeah, no, it does. Like if an immunosuppressed person is more susceptible to getting one of these, but then you're putting them on antibiotics, which then immunosuppress it. I don't know. It just seems like contradictory.
Yeah, it doesn't. I don't think it suppresses your immune system. But so these kids are not always immunosuppressed, but they're immunodysfunctional. They might have their immune system might be hyperfunctioning and misdirected. So, and the antibiotics don't, I think, like I said, they don't suppress your immune system, but they have an impact on it indirectly.
I see. Got it.
From the gut and from maybe adding resistance to the bacteria. So,
one thing I wanted to so last time you came, we were talking about how when kids go into adolescence, like puberty, their blood-brain barrier starts to close, and so we started talking about like what does the course of illness look like over time with PANS PANDAS, and I wanted to just kind of dig into that more.
Yeah. So again, it's individualized. So a lot of these kids, you have one that has a strep throat and they have severe anxiety, and they're 8-10 years old and they're moving back into the parents' room and they're wetting the bed and things like that, and you treat them and then they're completely fine.
So crazy.
And then the ones that we just talked about that have an underlying issue like mold, or they're constantly smoldering, or they wax and wane frequently and they have frequent flares, the parents have that question. So like, is this going to be forever? And from what, and I've only been doing this for a few years, but talking to some of the providers, and I've had the great blessing to talk to Nancy O'Hara, and I'm gonna plug her book for a second.
Yeah.
Demystifying PANS and PANDAS. Or anybody that has a child with PANS or PANDAS or thinks that they should pick up that book on Amazon.
Or if you're just curious and questioning mind.
And she has a lot of she has a
It's really
podcast and a lot of information online. But so if you talking to her, and she will say that a lot of her patients, you'll see an improvement or diminished symptoms around or shortly after puberty. So maybe around 13 to 15, in that age group, you might see the symptoms get better, and or less frequent. And then again, as you kind of mature and get into adulthood and so your early 20s. So you might have the kid that comes in and they have one flare and they get the antibiotics and everything's good and you never hear from them again. But a lot of the ones that are, waxing and waning and in the office off and on, they tend to get better, shortly after in puberty, and then you see less of it in the teenage years, and then a lot of times it will get better in adulthood.
Why is that again?
Well, we think it's because the blood-brain barrier. So the ability for the antibodies that are causing a problem in the basal ganglia in the area of the brain that they get this inflammation is less porous, so to speak. So.
We don't know MD. What does that mean? I think of like my face.
Less susceptible. So,
there we go.
Yeah,
that feels like a good word
to their own immune system.
Okay.
So,
great.
Yeah, I know. I'm like, it makes me feel hopeful.
So there's hope for a lot of these kids. But I mean, it's not every child follows that path. But that's what a lot of people are seeing. So.
Yeah. Okay, let's talk about treatment. So there's the pharmaceutical treatment like antibiotics.
What kind of antibiotic? Like, is it like doxy? No, I don't fucking know.
Azithromycin's like the most common one, right?
What is it?
No, so it depends on what you have, right? If you have PANDAS, so it's a strep associated, you're going to want to look at something that treats strep well. So, if you have it in your office and you have IM penicillin, so it's expensive, it really hurts, you have to use a gigantic needle. That's probably your best case scenario treatment for like someone that truly has group A strep and they're acutely sick with strep. Or shortly afterwards.
Is it one shot?
One shot, and it lasts, for a few weeks, and it works. It works well.
Wow.
And sometimes they do need a second shot, but
a few weeks.
But that is a really good treatment. But just access to that is not.
Yeah.
It's not
readily available.
What?
So, so you can some of the urgent cares might carry it, and the emergency rooms will carry it. But most pediatricians don't carry it because the vials are expensive, and if you don't use it, then you have to throw it out, and it really hurts.
I feel like because I was a chronic, I had to get my tonsils out because I got strep throat all the time, and I would always have to get a shot in my butt. Isn't that right? That's where you get the shot?
Maybe.
I don't know.
I don't know, but I always have to get
usually
the shot.
Nowadays, yeah.
All right. Anyway, so
that's one treatment if you have strep, but usually we're using Augmentin, which is amoxicillin clavulanate, or a cephalosporin. So Omnicef, which is the Ceftonir is the generic name. So those are the ones that we use or that I've found to be most helpful for initial treatment of just true strep. And I haven't found, and this is maybe for other pediatricians out there, amoxicillin just doesn't seem to work
By itself.
plain amoxicillin. So
Yeah.
amoxiclav seems to work well for these kids. Plain amoxicillin, they always come back. And I haven't
Interesting.
had it work.
Okay.
So that's strep or group A strep. But a lot of these kids, might have something else going on, like mycoplasma. And then azithromycin seems to work really well for those kids.
Yeah.
And then I'll also use, if we're not moving the needle with the cephalosporins or with Augmentin, I do sometimes go with azithromycin.
Yeah.
Or if they come in, they're negative, their strep culture is negative, or their rapid strep is negative, I'll use azithromycin right off the bat. So I'm going to choose something, and I don't know. I don't have an answer, as to what I'm treating from the office. I'll start with azithromycin. It seems to work well. It does have some anti-inflammatory properties in addition to being an antibiotic. So I think it's a good choice. It's once a day, which kids like.
Yeah, makes life
It's
easier.
not as bad as the Augmentin.
Is it liquid?
You can't.
Or
you
can
can-
all of
it can
these
be.
be whatever, be
Yeah, all of
liquid?
these can be liquid or
Powder.
powder.
Pill. Yeah.
Powder.
Yeah.
'Cause then you crush
Yeah, they
it.
snort it.
Yeah.
Yeah, it's great. You teach them young.
Maybe if we did that, they'd have.
It's quicker.
Yeah,
That's right.
totally.
Okay, what about supplement? Or wait, are we even done with
Yeah,
the
yeah, yeah.
medication? We are. Do we do pain?
Well, I mean,
mean-
you could have other, so there could be other infections. You could have allergies to some of the antibiotics, so that you have to take that into consideration. Skin infections. So we talked about impetigo to begin with. So a lot of times you don't know if you're dealing with a strep impetigo or staph impetigo. So a lot of times you'll choose something that can cover both. So clindamycin. I don't know if you're familiar with that one.
Yeah.
It does kind of wreck your gut. So that's one that I try not to use unless we need to. And then what's the other one? Keflex.
Oh.
Keflex. So Doxy for an older kid, but for a younger child, you wouldn't use Doxy unless you're worried about something that you can't treat without Doxy, which tick-borne illnesses a lot of times are treated with Doxy.
Yeah.
So those are the antibiotics. Again, azithromycin is probably the most common one I use if I'm not sure what I'm up against, because it does cover strep and mycoplasma. And then I like to use Augmentin and the Omnicef, but I try to stay away from plain amoxicillin. So.
Okay.
Supplements.
Yeah.
Let's talk about supplements.
Well, before you get to supplements, can we maybe talk about over-the-counter other medications?
Oh, yeah. Yeah.
Yeah. So probably the second most important thing in the initial regimen would be ibuprofen.
Yep.
So you can buy it over the counter or get it anywhere. So ibuprofen is the ingredient in Motrin and Advil most commonly found. So you can find it. Try to get it in dye-free form.
What?
Dye-free, so you don't want to use the
dye
dyes
free.
from back
Dye
to the
free.
So
I
a
was
lot
like,
of them
what
have,
is that liquid? Is that a pill?
yeah. So if it's orange, you want to stay away from it. But the dye-free ibuprofens, and you want to take that on a regular basis for like 2 or 3 weeks. So usually
Once a day?
Yeah, 2 to 3 times a day.
Yeah.
So
Lloyd.
We even do that, like, if our son, like, if we notice, like, he's, like, kind of, like, we feel like a flare is coming, we'll give him ibuprofen, and it, like, settles it down.
yeah, so there are some studies with these PANS and PANDAS kids that'll show that it decreases the length of a flare by a few days.
Yeah.
That's nice.
And it decreases the severity, and the parents will always tell you that it helps. So,
Yeah.
That's good.
and it may help them with their sleep too. So a lot
Yeah.
of them with sleep disturbances, falling asleep,
Yeah.
moving around a lot in their sleep, they'll sleep better if
Yeah.
they take an ibuprofen before they sleep.
Yeah.
And that's part of healing too. So if
Yeah.
they're not
Yeah.
sleeping, then
Yeah.
they're not going to heal. So the antibiotics and the ibuprofen are probably the 2 biggest pieces to
Yeah.
start with. And then I think you go into other things like, targeted symptom treatment. So, if it's depression, some kids are just extremely depressed. They're flat. They're, some of them will have suicidal thoughts. And those kids, you want to make sure you get to a psychiatrist. And
Yeah.
and there might be some things that you would suggest if depression is one of the symptoms. So
I have a question to that.
Yeah.
Okay, so but they metabolize it faster.
What?
Kids, like SSRIs and stuff. Like it doesn't take 3 weeks like it does an adult.
It's more it's less about metabolism and more just like their little brains are so much more responsive.
Faster.
They bounce back faster. Yeah.
Okay, never mind.
Well, and there's like a super high placebo response too for kids.
Oh, interesting.
Yeah.
Okay.
Yep.
All right, keep going. Supplements.
So
Oh, or we were not done.
Yeah.
Sorry.
well, I mean, I think it's all going to be targeted towards what the kid's symptoms
Yeah.
are. So
Yeah.
if the child's symptoms are really they're having a lot of sleep disturbances, and that's the main thing. And the parents are like, he can't fall asleep. He's, he has to sit up and watch television, or he's just sitting there and he can't fall asleep till 2 or 3 in the morning. Then sometimes I'll just give him melatonin.
Yeah.
The problem with melatonin is that a lot of times it wears off, and
Yeah.
then they're kind of up after a few hours. But
Yeah.
at least they get to sleep. Also for sleep, because a lot of these kids have sleep issues, but they also have anxiety. They have some of them are constipated, and one of the things that covers a lot of different bases is magnesium. So. If you haven't tried magnesium, I think it's helpful for all age groups. So
Oh yeah, I
magnesium
take it every night.
I do too.
can help you relax and fall asleep. It helps with anxiety during the day. There's different forms of magnesium. So if your child is constipated, you may want to use a magnesium citrate. If your child is not constipated, you might want to use magnesium glycinate or magnesium threonate. So there's a lot of different forms of magnesium, but it just kind of the one thing to look out for is loose bowels if you're using too much and you're using, the magnesium citrate especially. But it's super helpful. It's safe. I've only had a few kids, have some, I guess, side effects from it. And so I've had 1 or 2 report headaches.
But is that because they're not drinking enough water?
I'm not sure. I mean, I was, if you took way too much magnesium, it could potentially lower your blood pressure a little bit. And usually you only see that in IV magnesium therapy. But I don't know
Is
the
that
answer to
what?
that.
Is IV magnesium what? That's what I
Used
got in the hospital.
preeclampsia. Yeah.
Yeah. Okay.
So that can be very effective and safe. So I do suggest that a lot of patients take magnesium. And then if you have a younger child, you can do magnesium in the bath. So like an Epsom salt bath before they go to bed, and it can
Glorious.
help them relax. And that's an effective way to try to get them to sleep. And you can couple that with the melatonin, and that's safe. So that's a common go-to. I also use folinic acid, and there's a little bit of a story behind folinic acid. So folinic acid is the usable form of folate. And about a year ago, there was a study in the PANS PANDAS population that showed a lot of these kids, about 60 or 70% of them had antibodies to the folate receptor in the brain. And so you're blocking the folate receptor, unable to use folate. And so if you flood it with folinic acid, the usable form of folate, you're actually able to process a lot of different pathways in the brain. And so symptoms like anxiety and behavioral regression are due to that folate receptor antibody. And so the folinic acid works really well in most of the patients. And you'll notice within a few weeks, the parents will tell you that it's been very helpful.
Yeah.
And aside from antibiotics, ibuprofen, that's probably been the most helpful thing, outside of the antibiotics and ibuprofen that I've found. It's either going to work really well or it's just not going to work at all. And that's because you either you're one of those 2/3 of patients that have the folate receptor antibodies, or you don't. There's testing to look for that. I've never done a test on a kid. It used to be 2 years ago, it was a spinal tap to get the test, so nobody was doing that. They now have blood, you can draw blood work and send it off and get those test results back to see if you have folate receptor antibodies. But I just try the folinic acid, and if it works, then we stay on it. If it doesn't work, after a few weeks, you stop it. The problem with it is that in over the counter, the dosage is small. If you want to purchase it over the counter, there's a prescription form called leucovorin that you can use and you can prescribe, and you can get higher dosing there, and you want to use higher dosing. So, and that's been really helpful for all of the symptoms of PANS and PANDAS. And I would suggest that everybody at least try it. So that's a go-to as well. And I don't know if you have other supplements that you might use.
That kind of covers I always with my kid, I do the omegas. I do zinc is another one that's like really helpful because he has a lot of like ADHD type symptoms associated with PANS. But yeah, I think you kind of covered it. Yeah. So yeah, this was super informative.
Yeah.
Hopefully people enjoyed it.
Are there any resources or whatever for providers out there to like get more educated about this?
Yes, I would suggest providers and parents all look at, there's the aspire.care website. And there's a few videos, and Nancy O'Hara has a video that just kind of is an overview on there, a webinar. And then her book, Demystifying PANS and PANDAS, is great. Then PANDAS Physicians Network is another good website and resource for, for providers and for parents. And I think those are the main ones that I would suggest.
Yep. So. Okay. Awesome. All right. Well, thanks for coming.
Thanks
we appreciate
for having me.
This is great.
Yeah.
I needed a little buffer or like a reminder of all this stuff.
Yeah.
Because I forgot.
Yeah. It's a lot.
It's a lot.
It's a lot.
Anyways.
All right. Well, thanks for listening, y'all.
Yeah. If you have any PANDAS questions or comments, resources that we don't know about, DM us on Instagram,
please do.
whatever.
I'm happy to talk about this.
Yes. Okay. See ya.
Bye.
Thank you for having me.
Yep. Thank you for tuning into this episode of the Little Brain Campaign podcast.
If you enjoyed our conversation, give us a follow on your favorite podcast platform so you never miss an episode.
And hey, those ratings and reviews, they actually matter, like a lot. Take 30 seconds to leave us a review while you're still thinking about it.
Until next time, remember, we're all just trying our best.
See you next week.